I think that, there's really been sort of a dramatic move forward in prevention as a result of the data that we're seeing on post-exposure, pre-exposure prophylaxis, PrEP. I think it offers us a new tool to be able to, try to stem the tide of the epidemic. In addition to, treatment and prevention, I think PrEP is really a tool that we need to put in people's hands as another way to try to minimize the likelihood of them getting infected. So, I'm very positive about it. I don't think it's the end-all be-all. Obviously, I think that requires that people be committed to doing it, and that people still have to make good decisions about about their lives and about their health care and about their relationships. But I think this gives people a new tool and gives the healthcare community a new tool that it's very valuable. Well, since most of the patients that I see are HIV infected, it's not relevant to the individual patient that I'm seeing, but in many cases it might be relevant to their partners, and it might be relevant in their relationships. And so it becomes kind of complicated, but in many situations I have patients who are in long-term relationships, but they may be open relationships. And so even though we have data that says that if we have a discordant couple and we treat the HIV positive partner, that the HIV negative partner is at very low risk of transmission. If that HIV negative partner might also have other partners outside of their long-term relationship, then we have to consider that as a potential issue as well. And so I have offered PrEP, particularly in discordant MSM patient relationships where I know that there may be some, interactions outside of the primary relationship. So that's probably the situation for me where I will use it most commonly. It will be in the partners of patients of mine. And that could also be a case if this were a person who, a discordant relationship where the HIV positive partner is not on therapy yet, because either they have a really high T-cell count and have decided that they don't want to go on therapy yet, although I typically try to encourage people to be on therapy. But if it were that situation, then it might be a reasonable thing for their partner to be on PrEP.